you very much. Hope you all had a nice break. We're a couple of minutes behind, so the project manager in me is going to get us all back on time and doing things well. But just to say, I'm Rajman. I am from the University of York, and I manage a large consortium that Harjinder mentioned earlier, and I'll talk a little bit about that tomorrow. So this is not about me, this is about Rumanveer Singh Duley, who's from Aston University, and he is a first year PhD student, and the first time he's actually presenting in front of an audience today. So please encourage him, support him. I think the amazing work that PhD researchers are doing, and we need to support that so that they've got that support from the team. This is a really safe space, so thank you in advance to everybody. He's going to be presenting on community pharmacies and cardiovascular disease prevention in minority ethnic groups, and a systemic review of that. I don't know anything about that, but I'm sure we'll all learn lots today. So please listen, think about the questions that you have, and then later on, if you could please make sure, because we're having some technical difficulties with microphones, if you could just really clearly present your question and try and include the rest of the team here today as well, so that everybody can hear and learn from that. Thank you. So over to you, Rumanveer.
Thank you. Hi everyone, my name's Raman, and I'll be discussing my PhD project with all of you. So my research focuses on addressing cardiovascular health disparities, specifically exploring the role that community pharmacies can play in preventing cardiovascular disease in minority ethnic groups. So I'll start with a bit of a background about myself. So I studied pharmacy at Aston and graduated in 2015. I then worked as a community pharmacist for 8 years. And then coming from a community pharmacy background and being of a South Asian ethnicity and having experienced cardiovascular disease firsthand, it shaped my enthusiasm for this research area. So in 2022, I had a 3-month stay in hospital. I had open heart surgery to correct a problem with my heart valve. And that 3 months in hospital sort of shifted me away from community pharmacy, and I wanted to do something a bit more. So my research is part of a larger collaboration between Sandwell West Birmingham Hospital's NHS Trust and Aston University, addressing various aspects of cardiovascular health. My project focuses on exploring the role of community pharmacy in preventing cardiovascular disease in minority ethnic groups. So a bit of a background: cardiovascular disease refers to diseases of the heart and circulatory system, and it's the leading cause of death and ill health in the UK. It's estimated that up to 80% of premature cardiovascular disease-related deaths could be prevented through the management of risk factors such as diabetes, high cholesterol, high blood pressure, as well as lifestyle factors like alcohol consumption, obesity, and physical inactivity. So this is particularly important for the area that this research is funded by, Sandwell, as we have higher than average preventable deaths from cardiovascular disease, as seen in the graph in the diagram. And minority ethnic groups have a higher prevalence of cardiovascular disease compared to the UK national average. These differences stem from physiological susceptibility, socioeconomic status, cultural beliefs, and various other barriers to healthcare access, for example, language, literacy levels, and perceived hostility. Again, here's why it's of particular importance for the Sandwell area. The local population contains more than double the proportion of individuals from minority ethnic groups compared to the national statistics for England. Cardiovascular disease places a substantial economic burden on the NHS and on the wider economy due to social care costs and reduced workforce productivity. Preventative services can reduce preventable ill health and deaths and the overall economic impact. So, for instance, a study found that improving the detection and management of cardiovascular disease in England could save around 68 billion over 25 years. So before we continue, it's important to define minority ethnic groups. For the research, we adopted an exclusionary approach by defining minority ethnic groups as all high-level ethnic groups besides the minority white ethnic group. So that includes Asian, Black, mixed, and other categories. That's from the Office of National Statistics. Community pharmacies, due to their accessibility and their presence in communities, have the potential to address cardiovascular disease associated health inequalities, and they offer accessible, trusted and informal health services, which are qualities valued by patients. So pharmacies are well placed in deprived areas, often home to minority ethnic groups. That's termed the positive pharmacy care law, and that's in comparison to other healthcare providers where the opposite relationship is observed. So that's with fewer venues in more deprived areas. So now my PhD objectives. The project I'm working on, it consists of 3 work packages. The first is a systematic review of the literature, and it aims to provide an understanding of how community pharmacies can contribute to cardiovascular disease prevention in minority ethnic groups, including the challenges and enabling factors that influence this role. The second is a qualitative study. So that's interviewing family carers, patients and healthcare staff to get their perspectives on the potential role of pharmacy in this. And then the third work package, in consultation with stakeholder groups, and based on the findings, will develop culturally sensitive guidance tailored to the needs and preferences of the minority ethnic groups, and will translate the research findings into actionable recommendations for healthcare staff and policymakers, highlighting training initiatives and collaboration opportunities to further enhance the involvement of community pharmacies in CVD prevention. So taking a closer look at work package 1, the systematic review, it's registered on Prospero, and the protocol article was accepted for publication in BMJ Open. I conducted a comprehensive search of 6 academic databases for studies reporting on the role of community pharmacy in the prevention of cardiovascular disease in minority ethnic groups. I then conducted citation tracking to capture the studies that were missed in the initial searches. So this is the protocol that was published in the Open Access Journal, and it's available to read if you scan the QR code. So just more into the methodology that I used. I used the RAIN tool to screen the studies against the eligibility criteria. It's a tool that simplifies the study screening process, recording reasons for excluding studies and allowing a second reviewer to also independently screen the studies too. And then for critical appraisal, I used the mixed methods appraisal tool. And then finally, I used NVivo software to thematically analyze the data and generated themes to answer the research question. Right, and that's just a flow chart to show the flow of studies through the search. And all of these aspects, they add to the methodological rigor of the research, increasing the reproducibility of the review findings. Here are my 5 themes that were identified based on feedback from attendees of PPI meetings and the supervisory team. When I say PPI, that's patient and public engagement. So there's trust in healthcare professionals. Trust is crucial, influenced by culture, language, and respectful care. And then there's language and communication. Language barriers reduce trust and care quality, and patients value communication and support materials in their native language. Culture competency. So pharmacists need training to understand diverse beliefs, practices, and health behaviors. Then there's systemic barriers, so that's time constraints, lack of resources, and limited culturally adapted materials. And this hinders the effectiveness in the area at the moment. And then there's role of social networks. Family and community can both support and hinder health behaviors. So the findings suggest that community pharmacy has the potential to play a key role in reducing CVD disparities. However, there's a lack of UK-specific studies highlighting the need for more research in the area. So abstracts highlighting the systematic review findings have been accepted for poster presentations at academic conferences, including SAPSI, Annual Scientific Meeting in Cardiff, and the FIP World Congress in Copenhagen. So here I've outlined a couple of the challenges faced so far. So getting the definition right for minority ethnic groups was important to the research as it defines the eligibility criteria. With ethnicity, this was complicated as the terminology is constantly evolving, and by its nature, ethnicity is difficult to define. And ethnicity, it's important as part of this research, as it groups people according to shared cultural elements like customs, diet, language, religion. This is useful categorization as these relate to modifiable risk factors for CVD, so it's useful for targeting risk reduction services and health promotion. Another challenge has been recruiting PPI for minority ethnic groups. So it's notoriously difficult to recruit from these groups in research. PPI and a separate healthcare professional stakeholder group will guide various stages of the project, from developing recruitment strategies and interview schedules to validating and interpreting the emergent findings. Here are the posters that I developed for recruitment for these advisory groups, and they're being circulated on social media. So it proved very difficult to form these PPIE stakeholder groups. My way around that has been taking the research to the stakeholders, attending events where stakeholders will be present and seeking their feedback there. Also, a strength of the research is that it inherently has patient and public involvement because of my own experiences with cardiovascular health. So the second work package. So as established in the systematic review, there's little known about how well community pharmacy cardiovascular health services currently meet the needs of minority groups in the UK, or what improvements could be made to better support these communities. The interview study aims to explore this using semi-structured interviews and thematic analysis to find common themes that emerge to answer the research question. I plan to interview 20 minority ethnic group cardiovascular disease patients, 10 family carers and 20 healthcare professionals. So that's 50 people in total. And I aim to start the interviews in August, and the ethics is currently under review. This leads on to work package 3. So the findings of the study will help produce recommendations for healthcare services and guidelines for patients and healthcare practitioners, which will hopefully result in improved health outcomes and all the associated benefits that come with better health. We're collaborating with cardiovascular theme lead at the CPPE. They're well known among community pharmacists, and they produce the continuing professional development resources. We'll produce actionable recommendations and guidance from the results of work package 1 and 2, along with the feedback from PPI. This fulfills the requirement identified in the literature for strategies to be co-produced, tailored and culturally sensitive, ensuring the guidance is relevant and meaningful for the target communities. Thank you.